Hi, my name is Vincentia Johnson, and my portion will be starting with the introduction. No doubt you've heard of the term opiate epidemic. It gets thrown around on the news. The opiate epidemic, also is known as the opiate crisis, has become a hot bottom issue everywhere: social media, blogs, newspaper, nursing journals, etc. However, many may not know what the crisis actually is. The opiate epidemic specifically refers to the growing numbers of deaths and hospitalizations from opiates, including both prescription and illicit drugs. In recent years, deaths from these drugs have skyrocketed. According to the Centers for Disease Control, in 2019, over 400,000 a year, or can I say 115 deaths a day across the US from drug overdose, is now the leading cause of accidental deaths in the United States, largely due to the opiate epidemic. The opiate epidemic first gained its notoriety around 2010, but the factors behind it began several years earlier. Despite the recent increase in public awareness, the opiate epidemic, the background of this epidemic is still disproportionately unknown to the public. This epidemic, it is a global crisis which impacts not only individuals' well-being, but our economy, not only in the United States, but it is a global problem. In fact, many may wonder, how did this happen? It's crucial for people, not just in the United States, but everywhere, because this is a global problem. But it's also crucial for the next generation, our children and our children's children, to understand the fundamentals of this epidemic. The epidemic, it's a multifaceted problem. Its roots and its progressions are entangled within the medical and social issues that has spanned for years. So you want to know when and how this opiate epidemic developed. It's crucial for people worldwide, not just in the United States, to know and understand the fundamentals of this epidemic. So the historical background: there's not one factor that is to be blamed for the opiate epidemic, but there's a very precise sequence of events that accelerated the rate of this problem. Starting back in the 1990s, there was an outcry in the medical community that not only was the pain level of its patients underassessed, but it was also untreated and it was misunderstood. So this actually set the stage for what many consider to be the initial step leading to our current problem, this epidemic. Pain being introduced as the fifth vital sign. The Joint Commission revised pain standards and allowed this with the fifth vital sign concept. These new standards have required that a patient's pain was to be assessed on every doctor's visits. The best tools were, these tools were to be available for these patients, and they were to be properly documented. Physicians now had to ask how much pain a patient was in during every visit, and they had to document it. Because of reaccreditation was a factor, patients would base, as far as the adequacies of their services by these providers, whether or not they were able to prescribe pain medications or not. Physicians began assessing every patient for any type of perceived pain. Frequent evaluations was done in order to meet these progress guidelines of adequately, properly medicating these people so that their pain issues can be alleviated. The reason behind this was that if a patient was completely pain-free and verbalizes during every encounters, the physicians, now get this, would not face any type of disciplinary actions, and they would be able to be reaccredited. Next, we entered the pain mill. according to the Florida's Office of Attorney General in 2015. The term pain mill defines as a doctor's office, clinic, or healthcare facility that routinely conspires in the prescribing and dispenses of controlled substances outside of the scope of prevailing standards of medical practice in the community or violates the laws of the state. These unscrupulous physicians noticed this population of patients that require strong pain relief, essentially, and they took advantage of the situation. These opportunist physicians set up independent pain management centers, often accepting cash only, and allow patients to receive their drug of choice. These and similar practices throughout the country set the foundation for the current problem we have today. Unethically prescribing medications that not only had a high likelihood of addiction when given over long periods of time, but also falsely giving the impression that these medications would always be available for these patients. In response to the rapid increase in rate of overdose and deaths related to prescriptions opiate, according to Baker 2016, the Joint Commission removed the requirements to assess the fifth vital sign. When Purdue Pharmacy paid a settlement amount of over $600 million for misbranding OxyContin in 2007, the public became more aware of this global problem. Since then, large pharmaceutical companies and its owners have been blamed by the public for instigating and worsening this problem that we have today. Also, doctors and pain management have pleaded guilty to prescribing opiate medications excessively throughout every state in the United States. Last but not least, it's easy access within the United States. The relatively ease in which heroin and its synthetic counterparts are available to enter the United States from countries such as China, Mexico, have brought this problem to a chaotic epidemic. Labs has also pushed the opiate use and abuse to staggering epidemic levels.
Thanks, Vinny, for the information. My name is Katie. I'm a registered nurse at a local hospital in the intensive care unit. I'm going to discuss why we should have supervised injection sites readily available to those who use intravenous drugs. In 2003, Canada opened its first legal supervised site to the public, known as Insight. Insight's data supports its main objectives. The objectives include reducing public disorder, a reduction in disease transmission, and fewer accidental overdoses. Insight provides programs that allow the individuals a chance to enter into a detoxification or addiction treatment programs. They have also demonstrated a reduction in crime surrounding the sites and notes that they are cost effective in comparison to other programs. Since its opening, several peer-reviewed studies were conducted that indicates places like Insight provide individuals with hygienic spaces where they can inject drugs while being supervised by trained professionals. According to Ziegler, Ray, and Langenhau, places like Insight are highly controlled environments that allow an individual a safe and hygienic place to inject. These locations allow the individual a facility to use where everything is clean and disinfected between users. It is also a supervised environment that allows them a proper place to dispose of used drug paraphernalia when they are finished. Ziegler also goes on in the ever-changing narrative supervised injection site policy making in Ontario, Canada, to say that with programs like needle exchanges, these individuals will receive new sterile equipment with each use. Evidence-based harm reduction strategies have been implemented to help reduce needle sharing and thus reduce HIV and viral hepatitis risks. In the past, many users would share needles because it was easier than trying to obtain equipment each time. They noted a 70% reduction in the sharing of needles because of programs like this. Another benefit to supervised injection sites is that there are trained individuals on location at all times when people are using. These men and women are trained to provide a non-judgmental environment where the users will be monitored before and after using. The staff person observing the injections have been trained in overdose prevention, resuscitation using naloxone and rescue breathing, injection techniques, and overall harm reduction. Ziegler suggests that the data obtained from Insight has showed that overdose mortality rates have reduced by about 35%. Usually when individuals have a reaction, this tends to occur immediately. By having these trained individuals there, their life-saving medication naloxone can be administered and emergency personnel can be called. This saves time between the overdose and treatment, thus reducing complications that can arise from using these IV drugs. The other benefit of having trained professional on site is that they can provide real-time education about countless things that occur as a result of injectable drugs. This can include things like life-saving injection practices, among others. By providing information before their user injects, study shows that there is a reduction in things like soft tissue injuries and other injuries related to comorbidities. They will also be educated on naloxone. This medication is an opioid receptor antagonist that has the ability to reduce an opioid overdose. Once educated about what an overdose looks like and how to administer their medication, they can receive a free kit to take home with them in case they use somewhere else or in case someone they know accidentally overdoses. In the past, users needed a prescription for these kits, but with supervised injection sites and changes in the laws, these kits are now free and readily available. Holland states in his research study, Emergency Department Physicians and Pharmacists' Perspectives on Take-Home Naloxone, that over a 2-year period, they were able to reverse 57 overdoses with naloxone alone. Australian Capital Territory had physicians and pharmacists from several Australian emergency departments train approximately 2,000 participants in the use of naloxone. 57 times this medication was used to reverse an opioid overdose. 57 times someone was able to wake up and receive treatment when it's possible they wouldn't have made it without this medication. With successful administration of naloxone and results like these, education is the key to saving lives. Nice things about supervised injection sites is that the sites are open to the community, not just those who use intravenous drugs, but also general public. This allows access to anyone from the general public to enter and receive help finding medical care. They will receive educational material that is clear, pertinent, and designed to have an impact on those who read the information. It is hard to come up with an argument against supervised injection sites when they have overwhelming data that demonstrates they are meeting their objectives and saving individuals.
Thank you, Katie, for that information. You definitely brought some compelling points to our attention. And yes, it may be true. The CDC states that syringe service programs protect the public and first responders by facilitating a safe disposal of used needles and syringes, even providing testing, counseling, and serial injection supplies. It'll help prevent outbreaks from other diseases such as viral hepatitis and HIV. There's no denying that all of these things are good for the public, but I wanted to shift our viewers' attention to how these programs truly affect those in our community who may not participate in drug abuse. I'm talking about the vulnerable population. That can be anyone, minorities, young single mothers who are doing their best to maintain a job and take care of their children, all the way down to the young children in our community. The decisions that we make now by setting up these different programs, it can have a major influence on our community now and in the future. So first, I want to talk about money. everyone wants to know, how much does it cost to even put up or maintain a syringe exchange program? Well, according to PLOS 1, a journal that was published in 2019, the estimate cost of establishing and operating a syringe program, which is free to United States clients, it's broken down into different parts. One is the startup cost, and you have your annual costs with paying for staff and operating, and also the preventative services that we talked about earlier. It was estimated that in 2016, based on the program size and obviously the location, whether it's a suburban area, an urban area, a rural area, and the amount of people that are being serviced, anywhere from 250 to over a few thousand people, it can cost anywhere from $400,000 to almost $2 million. And that's just the startup cost. If you look here, we also have supplies that you have to pay for. Syringes themselves, they can be $1 to $3 a piece. And as you can see, at large clinics, it can be over $1 million just for the syringes alone. So that's a lot of money. So the next question is, we have to think about, where are we getting the money? Where is the money coming from to foot the bill? Well, to put it simply, the money is coming from you and I. These programs are fully funded by the state and local government. And guess where they get the funds from? Well, according to Urban Institute, 19% of the state's revenue come from individuals' income taxes, and 30% of local revenue come from property taxes. And you can see that here in this picture, that we're not talking about a small amount of money. We're talking about trillions of dollars each year that are being allocated to these different programs. And it makes you think, where else could this money be utilized? You can think about where we live here in the city of Buffalo, where some of these programs are actually located. We have a failing school system. Could these funds be better resourced in our school system? Another point that I wanted to bring out is that how are these programs affecting the nearby communities that they're placed in? I'm not sure if you've been able to see the site of a clinic before, but I just want to set the scene for you, because I've been able to witness it myself. Getting off work early mornings, it's a pretty hectic and chaotic scene. You see people jumping in and out of cars, coming in and out of the building. Sometimes there's altercations. People are clearly on drugs and high and falling about. And actually, they're actually exchanging drugs right outside the building. And if we're talking about somewhere locally, we have a location here in West Buffalo that's in Elmwood. If you look at the map here, this is the location, and right next door is a high school. Okay, so people are coming out of this building, and there are school children and at this age that can see everything that is going on. People are exchanging drugs. And where do you think these people are going to do these drugs? They're not going towards this way, towards the city where all the businesses are. They're falling back more towards the west side of Buffalo, where there are apartment complexes, housing, places where families are. These are definitely things that we want to consider, since our youth they're living in this area, and they're highly influenced by the things that they see. Research showed that if adolescents are living in areas where in disadvantaged neighborhoods, such as this one pictured here, they're more than likely going to start abusing alcohol and drugs themselves, just from being in that environment. Another study was actually conducted in Baltimore, and they analyzed that after they opened a needle exchange program, that there was a slight increase in the number of drug-related arrests. Another point that I wanted to bring out is that these needle exchange programs are supposed to decrease the spread of disease, such as viral hepatitis and HIV. But in order to do that, these dirty needles have to be returned. But we're finding them all on the ground in our neighborhoods and in the communities. It was reported in our local news that a man was just walking down the street and piles of syringes were just laying on the floor. So we have to dive into what are the barriers into them actually being returned. Well, Spalding, he showed in this picture right here, research was done, that these are some of the reasons why they said that people were unable to return the syringes. Just to name a few, they're selling the syringes. They're nervous about law enforcement, personality attributes. They are lazy or can be they're ashamed. And another thing is they may not have transportation to return these dirty needles, which is just putting the public back at risk. My final point would be these programs, they're being implemented to lower, the spread of disease. But what about the ongoing epidemic of the opioid crisis that we see every day? According to the most recent reports from the National Institute of Drug Abuse, more than 70,000 people, Americans specifically, died from drug-involved overdose in 2019. And that's including illicit drugs and prescription opioids. So while we're decreasing the spread of disease, the death toll of opioid use, it just continues to climb. And if you think about when these clinics were, these exchange programs were implemented, they were in the early 2000s. Since then, the numbers haven't decreased, they continue to rise. And these programs, as we mentioned before, they do offer case management to coordinate care to get services to these individuals, but they have it was reported that they have a lack of motivation to utilize the case management and enter drug treatment because they have no way to get there, or they're just not motivated to do so.
Hi, my name is Natalia. I'll be doing the rebuttal to the pro-argument. In response to the pro-argument, I would like to bring up the following points. The idea of the hygienic space and needle exchange has its negatives. According to the National Research Council, one possible negative outcome is increase in the number of improperly discarded used needles. This may be due to the increased number of available needles to the public. Also, the National Research Council Institute of Medicine panel and the needle exchange and the bleach distribution programs cannot provide clear evidence that needle exchange programs decrease HIV infection rates. Since people may not choose to inject in a controlled setting and may opt to inject when and where convenient, this brings us to the idea of needle exchange and another big issue that became known. Because needle exchange sites are not always available where and when people inject, an unusual black market emerges. People bring in large numbers of used needles and then resell the clean ones they receive. This increases the number of needles that circulating on the streets, and there is no way to control needles sharing at that point. Regarding the statement made about the staff with trained individuals and preventing overdoses, there is also concerns. According to the public health advocate, during the Obama administrations in 2016, Congress lifted the ban on providing federal funding for the needle exchange programs, a ban that had been in place since 1988. This allowed for the federal funds to be used for program expenses such as staff, substance use counseling, and outreach, but not for syringes themselves. The public became very concerned with this decision because many believe that the government is simply enabling addicts rather than helping them, and that needle exchange programs contradict efforts against the war on drugs. Instead of leading to the rise in drug abuse. Because of this, many are against using tax dollars to pay for expenses associated with this, including the staff. The National Council for the Mental Well-Being is concerned that widespread access to the opioid overdose reversal drug naloxone would promote drug use. The National Research Council and the Institute of Medicine also found that this idea concerning and stated that needle exchange will lower the perceptions of risk of injection drugs use, and those attract more users to inject drugs and other forms of illegal drug use. Finally, I would like to comment on the education portion of the argument. As I previously stated, the idea of educating on safe injection and using government funding to do so does not sit well with many people. They believe that this to be promoting the drug use. According to the National Research Council and Institute of Medicine, assurance of injecting equipment condemned by the government will send a message undercutting efforts at combating illegal drug use and will promote more drug use. Community members often oppose the use of public areas for those programs, citing dangers for residents and children especially. Efforts to educate on safe injections could be perceived as harmful tool in the hands of minors and vulnerable individuals. Making it easy accessible may be viewed as a threat. Okay, I'm done.
Hi, I'm Rebecca. I'm doing the rebuttal to the con argument. The opioid crisis in the United States plays a large role in the spread of HIV and hepatitis infections. According to the CDC, syringe service programs are proven to be effective community-based prevention programs that can provide a range of services, including access to the disposal of dirty needles, injection equipment, vaccination, testing, and linkage to infectious disease care and substance treatment. Needle and syringe exchange programs vastly decrease the reuse of needles after injection and drug use. The purchase of safe needles reduce the risk of HIV and other blood pathogen transmitted diseases. Unlimited distribution of needles and syringes, increasing the number of access points and offering different distribution methods found no increase for HIV prevalence. Needle exchange programs and safe injection sites are safe and allow for the clean use of needles to reduce healthcare costs for treatments such as HIV and hepatitis. The use of syringe service sites increases the chance of wanting to seek treatment. Research shows that the new users of syringe service programs are 5 times more likely to enter drug treatment and about 3 times more likely to stop using drugs from those who do not use the programs. The use of safe injection sites and the syringe service program also allows for teaching of how to reduce overdose deaths and how to use Narcan in an overdose situation. The syringe service programs have not shown an increased crime rate in areas, but increasing safety of the community by reducing needle stick injuries due to proper disposal. According to the CDC, syringe services programs can benefit communities and public safety by reducing needle stick injuries and overdose deaths without increasing illegal injection of drugs or criminal activity. Improper disposal of needles is more likely if no syringe service programs are in place, causing needle stick injuries in the community to increase. According to the CDC, evidence demonstrates that syringe service programs do not increase illegal drug or crime. Studies in Baltimore and New York City have found no difference in crime rates between areas with and without syringe service programs. In Baltimore, trends in arrests were examined before and after syringe service programs were open and found that there was not a significant increase in crime rates. Syringe service programs benefit the community by allowing proper disposal, increasing the community safety without increasing drug crime rate in the area. Government funding by taxpayers allowing syringe service programs, HIV testing, hepatitis testing, and Narcan, and education on HIV prevention to the community. By allowing this funding, this decreases millions of dollars in taxpayer funds for treatment of overdoses, HIV, and hepatitis infections. According to the CDC, the estimated lifetime cost of treating one person living with HIV is $450,000. Besides HIV and hepatitis infections, IV drug users are at risk for other infections such as MRSA and endocarditis. According to the CDC, in North Carolina alone, the rate of hospital discharge diagnosis for endocarditis related to drug dependence increased more from 2010 to 2015, with hospital and costs increasing from 1.1 million in 2010 to over 20 million in 2015. By allowing safe injection sites and clean needle use, it decreases the chances for infection and hospitalization for these infections. Syringe service programs also provide guidance for treatment services, allowing the decrease in potential HIV and hepatitis infections and hospitalization. Thank you. I'm done.
In conclusion, the rate of deaths due to opiate drug overdose has increased substantially in this 21st century, and it shows slow signs of improvement. The ongoing opiate epidemic plaguing the United States is an issue that has had numerous contributors that have propelled the issue to its current level. From this perspective, the future appears rather bleak, with no clear answers on how to slow this destructive wave of morbidity and mortality due to opiate use and abuse. The versatility and multidisciplinary skills of the public health workforce will play an integral role in helping to address this multifaceted problem. Keeping in mind, please, the opiate epidemic isn't just one person's problem, and it will take everyone to give it the attention that it desperately needs, along with being fully educated about Narcan, needle exchange, and how it can save someone's life. But in order to do this, everyone must be on the same page, meaning open to agreement and willing to do the work to work together. Talk to your loved ones openly and remove the stigma of addiction. It isn't something that only happens to the weak. It is a biological reaction that can happen to anyone, regardless of your race, regardless of your education, and regardless of your economical standard. If you believe you or a loved one shows these symptoms of addiction, educate yourself, contact a treatment provider. Addiction does not have to be the end, but it can be a detour. Thank you.